This is Maitland's hip scour test. It's a test that Maitland came up with and he felt was very sensitive in predicting problems of the hip. And I agree, I think it's a very useful test for the hip. The hip will start in about 90 degrees of flexion. You will come down lower and settle into a position where the knee is up against your chest and your hands are cradling the knee. You can do it with two hands or do it with one hand. I've got pretty big hands and arms, so I prefer just to do it with one. It's important then to get the patient to completely relax. And then you're working up in small circles, small concentric circles as you work up into flexion and adduction. And then ensuring that the patient's completely relaxed. Continue working up into flexion and adduction. What you're trying to do is get up into all the corners of the joint. So we'll come up to flexion and adduction, then we'll work out into a more neutral position, but straight up into flexion still. And then we can come back the other way until the heel just about touches the ground. And this is especially good for testing that very northeast corner of the joint surfaces. Because typically when a hip starts to degenerate, that is the area where the symptoms come on first. There'll be a pinchy feeling or an uncomfortable feeling, and there'll be a little glitch in the movement. And you'll find if you get a positive up in this area, that what you can do is just back off into a little less adduction, and then you can get around the blockade and work your way further up into flexion. But this allows to get into that full flexion closed plaque position and make sure that we've got the full range of motion. It's also a good treatment technique too, but it's a very good assessment technique and a very good way of ruling out any problems with the hip. If that's clear, you can be relatively certain that there's no joint problems at the hip.